for cancer does not mean that a man will get a prostate cancer. It just means that he is an increased risk. It's also important to understand that not all tumors are cancerous. Benign means that tumor is not a cancer, but it might slightly grow in size, but a malignant means the tumor is a cancer. Some malignant tumors grow very fast, while others grow much more slowly. If a malignant tumor is left untreated, it might spread to other parts of the body. This spreading of the cells cancer are called metastasis. Who is on risk of having prostate cancer? 4 main risk factors increase main chance of developing prostate cancer. If you feel you have any risk factor for developing this disease, you should speak with your doctor. The first one is the age, which is the biggest risk factor for prostate cancer. In Europe, prostate cancer is commonly diagnosed on men over 65 years old, but it can happen in younger men. Ethnicity. Black men have twice the risk of developing prostate cancer than white men. Asian men, on the other hand, have the lower risk. It is unknown why men's ethnicity or race increases or lowers his prostate cancer risk. Family history. We all inherit our genes from our parents. Some prostate cancer might be linked to genes passed from generation to generation by either parents. Although a man risks developing prostate cancer increases if he has a family history, most men who get prostate cancer do not have any family history. For your information, the genes are made of DNA. They contain information that determines our traits. For example, having red hair is a genetic trait, passed from generation to generation. If you have close family members diagnosed with prostate cancer under the age of 60 years old, and are they concerned about your risk, speak to your doctor. Another risk factor is the diet. It is well known that eating a balanced diet and doing regular physical exercise keep you healthy. A balanced diet includes eating plenty vegetables, fruits, and fiber, unlimited red meat, processed food, high-fat food, sugar, and alcohol. Men who have very overweight or obese may increase the risk of developing a prostate cancer. But what is a processed food? Processed food includes ready meals, takeaway, savory snacks, cakes, and biscuits. What we call obese. Obese means you are very overweight in a lot of body fat, which puts you on a risk of serious health problem. What are the stages of a prostate cancer? Well, the prostate cancer can have different stages depending the size of the tumor and how far the cancer has spread. Although there are different ways of describing the stage of the cancer, one of the simplest ways to understand it is using the number 1 to 4. If you have been diagnosed with prostate cancer, you may have heard about the term localized, locally advanced, or metastatic. All of these different terms can feel overwhelming. An easy way to understand the stages is looking at stages 1 and 2 like an early or localized stage, and stages 3 and 4 locally advanced stages. In the metastatic disease, the prostate cancer can spread to the local lymph nodes or bones and even organs such as the liver, lungs, and the brain. This spread of the cancer cell through the body is called metastasis, or you may hear it called metastatic prostate cancer. When cancer spreads or metastasizes to other organs, it is referred as metastatic disease. Sometimes cancer cells are found in the pelvic lymph nodes but have not spread elsewhere else in the body. This is called node-positive disease rather than metastatic disease, as the cancer cells have not spread to other lymph nodes or organs around the body. Node-positive disease can be treated. You may be offered surgery to remove the diseased lymph nodes, radiotherapy, or hormone therapy. There is another concept that we call grade. Stages and grades are different. Stages inform your doctor of the size of the tumor and how far the cancer cells have spread. Grades give your doctor an idea of how fast the tumor might grow and the cancer might spread. In general, a lower grade indicates slower growing of the cancer, and higher grade indicates a faster growing one. For prostate cancer, the grade, we call it Gleason score. The Gleason score is used after biopsy. The pathologist has looked at the cells. This score helps your doctor predict how the cancer might behave and the treatment you need. Depending on the Gleason score, there's another category called ISUP. This is the International Society of Urological Pathology, ISUP. This categorizes the prostate cancer into 5 groups, from 1 to 5. The lower ESP grade is better prognosis. What symptoms you can have? The prostate cancer may not cause any symptoms in the early stages. More advanced prostate cancer might cause signs and symptoms such as difficulty for passing the urine, a less powerful stream of urine, blood in the urine, blood in the semen, bone pain, commonly in the back, losing weight without trying, problems controlling bowel movements, erection problem called erectile dysfunction. Difficulty for passing the urine and less powerful stream are commonly caused by enlarged prostate as well. We call it benign prostate enlargement or BPE, previously called benign prostatic hyperplasia or BPH. BPE is not a cancer and is a treatable condition. If you or your family member are experiencing any of the symptoms, this is important to get a prostate check. How should I approach my doctor? If you feel frightened, anxious, or embarrassed about your prostate problems, it is always best to speak to your doctor. It is important to find the words that are right for you. We have listed some potential icebreakers for you below. Why not say them aloud and see which one feels most natural to you? You may even find rehearsing what you want to say boosts your confidence and comfort level. For example, I want to ask you about men's health issue. I am having some problems that I want to talk about. I think I may have a prostate problem. I'm having some problems peeing, weeing. I am having problems keeping erection. My friend's brother, father, uncle has been diagnosed with prostate cancer. I am worried about prostate cancer. I have blood in my pee, wee, semen. Just remember, your doctor is a healthcare professional. He or she will listen to you and discuss the best way forward. What else can we do? While you may have heard about screening for cancer, for example, mammograms to check for the breast cancer, not all countries have prostate cancer screening program. For this reason, it's very important to get a prostate checkup if you have any of the known symptoms or family history of prostate cancer. The most common test is the digital rectal examination, known by prostate check. A prostate check is a quick and simple test to see if you might have a prostate problem. It involves your doctor inserting a gloved and lubricated finger into your back passage, the rectum, to feel your prostate. We realize this might seem embarrassing, but the examination is over very quickly. You may be aware of some pressing and get brief urge passing to the urine, but the examination itself is not usually painful. The PSA test is a simple blood test that measures the amount of PSA protein in your blood. It can help to diagnose or rule out prostate cancer as a cause of your symptoms. If PSA level is high, it could be a sign that something abnormal is happening in the prostate. High PSA level do not mean that you have a cancer, but high PSA levels should be investigated to rule out prostate cancer. If PSA levels in the body are high, it could be signs of something abnormal, like an infection of urine, prostatic hyperplasia, or also it can be rise after digital examination, after intercourse, or also riding a bicycle. Unfortunately, there's no single test for prostate cancer. Your doctor will discuss the available tests with you and use the results to see if you are in risk of having prostate cancer. Your risk is based on several factors, including PSA level and the result of your prostate examination, as well as your age, family history, and ethnic group. If you are in risk, you should be referred to a hospital to discuss for this test. Such tests include ultrasound, CT scan, MRI scan, or bone scan. Magnetic resonance imaging, or MRI scan creates pictures of the inside of your body using magnets and radio waves. An MRI scan provides a detailed look inside of your prostate. The results will help your doctor decide if you need to have a biopsy. It might also help your doctor to find out if any cancer cells have spread to other parts of the body. During the MRI scan, you will be asked to lie on the scanner bed. The scan itself can take some time, like 30 to 40 minutes to complete. The bed will move into a scanner. There is a two-way intercom inside the scanner, so you will be able to communicate to the radiographer the whole time. You will also be given a device to hold in your hand with a panic button. If you feel anxious during the scan, just let the radiographer know by pressing the button. The scan itself is painless, but it can feel uncomfortable as you have to lie very still. It is always very noisy inside of the scanner, and you will be given ear defenders to wear. Some people find claustrophobic inside of the scanner and have said wearing a sleep mask helps easier the fear. Computer tomography or CT scan is a commonly known uses X-ray taken at different angles. These X-rays are sent to a computer which creates three-dimensional image of the inside of your body. A CT scan does not take very long to complete. The results might help your doctor to find if any cancer cells have spread to other parts of your body. During the CT scan, you will be asked to lie on the scanner bed. The bed moves forward and backward through the whole scanner. You will be able to communicate with the radiographer with the whole time. You might need to have an injection dye also for this procedure. Your doctor might recommend that you have a bone scan to determine if cancer cells have spread to your bones. Before the bone scan, you will need to have a radioactive dye injected onto a vein in your arm or hand. Only a small amount of radioactive dye is used, and it is safe. You will need to wait for 2 to 3 hours for the dye to travel through your veins and into your entire body before the scan itself takes place. During the bone scan, you will be asked to lie on the scanner bed. The scanner will move very slowly down your body to take the pictures. The scanner will pick up abnormal areas of the bone called hot spots. Not all bone abnormalities are cancer, and the scanner may pick up other conditions such as arthritis. This can be extremely stressful time for you, especially waiting for the results. If you are struggling to cope, try not to hide your emotions. Talk to your family and friends. If you have not done so already, speak to your doctor about professional support, such as counseling services or local support groups. PET-CT scan use mild radioactive drug to show up areas of your body when cancer cells are more active than normal cells. Prostate-specific membrane antigen, or PMSA, is a protein found in the surface of the prostate cancer cells. PSMA PET scan looks for areas for the body where the PSMA protein is found, showing the presence of prostate cancer cells. Although PMSA PET-CT scan are not commonly used, there are evidence to suggest this type of scan is more accurate than others as detecting for your cancer had spread other parts of the body. In time, PSMA PET scan will likely become the standard scan used to detect the extent of prostate cancer spread through the body. An ultrasound uses sound waves to send image to a computer. This allows your doctor to see inside of your body. An ultrasound of your prostate involves your doctor or a sonographer inserting a lubricate wand-like device called probe into your back passage, the rectum. The examination does not take long. It might feel uncomfortable, but this is not usually painful. A biopsy of the prostate is the most accurate way of seeing you have a prostate cancer. However, a biopsy involves your doctor using a thin needle to take a small tissue sample from your prostate. Because of this, a biopsy is only done when other tests strongly suggest you have a prostate cancer. Biopsy samples are sent to a laboratory where a pathologist looks into them under the microscope to check for prostate cancer cells. The result will help your doctor to plan to discuss your treatment options. The pathologist is the doctor who diagnoses disease by examining the cells and tissue samples. There are two main types of prostate biopsy. Could be transrectal under ultrasound or 2RUS or transperineal biopsy. It is important to discuss the risk and benefit of each procedure with your doctor to make sure it is the right one for you. After receiving the diagnosis of prostate cancer, you will discuss the treatment with your doctor. There are different treatments of prostate cancer. The treatment you are offered will vary depending on your age, overall health, and your tumor's stage and grade. Your doctor will discuss the results for your diagnosis text and your treatment options with you. The main treatment includes monitoring the cancer, surgery to remove the prostate, radiotherapy, and hormonal therapy. These are some of the possible side effects that you can have. First of all, leaking of urine. It is normal to experience some loss of bladder control, called urinary incontinence, and leak urine after surgical or radiation treatment. But most of the men, this will improve over the time. For more bowel problems, Damage to the rectum caused by surgery or radiation therapy can lead to bowel problems, including bleeding of the rectum, diarrhea, urgency to go to the toilet. But this is very rare. Some men find they have softer stools during radiotherapy, but is resolved in time after treatment has stopped. Erectile dysfunction. Some treatment can damage the nerve and the blood supply of the penis, making it difficult to get or keep an erection, called erectile dysfunction. Unfortunately, erectile dysfunction is the most common side effect of prostate cancer treatment. However, there are options for managing this issue during treatment. Most men seems an improvement over the time once treatment has stopped. If you are undergoing surgery, depending on the stage and grade of your cancer, you may offer nerve sparing surgery. This is to reduce the risk of erectile dysfunction or leaking of urine. Unfortunately, some cancer cannot be removed without cutting or damage the nerves, meaning that you might always need treatment to help get an erection. Living with prostate cancer can affect your everyday life, work, and relationships. You may experience side effects from treatment even when the treatment has finished, which can affect your physical health. You may also have to be worried about your cancer coming back, which can greatly impact your mental health. It is important to note that you are not alone. Talk to your doctor about local support groups or counseling services that may help you and your loved ones. You can have some physical and emotional effects like extreme tiredness or fatigue. It's very common in men with prostate cancer and can affect everyday tasks, social activities, sleep, and overall concentration. If you are feeling fatigue, you should not drive. Some men cope better with fatigue than others. If you are usually active, you may feel frustrated by an extreme lack of energy. These feelings are normal. Sometimes small changes can help improve your fatigue, can help you feel in control of your cancer. You can have also leaking of urine. If you have had a surgery to treat your prostate cancer, then you might find this leak urine. This is entirely normal. Some men find they only leak a little bit, and some others find a lot. For most men, the leaking lessens over time. Leaking urine can feel embarrassing, but there are products that may be find healthy for you. Incontinence pads lines your underwear and absorb any leaking urine. They are discreet and so no one can know it is there. Talk to your doctor about the treatment. You can also have difficulties for passing the urine. It may be because your tumor is causing your prostate to press against the urethra. Your doctor may recommend medication or an operation to remove the part of your prostate, called transurethral resection of the prostate or TURP. This operation will not cure your cancer but will help you pass the urine much more easier. You can have also problems in your sex and relations. You may feel down, angry, or stressed, and this emotion can be change your feelings about sex. Some treatments can damage your nerves and blood supply to the penis, making it difficult to get or keep an erection. Call it erection dysfunction. If you have had hormone therapy, this is also affect your desire. If you have a partner, talking about sex and how you are dealing with your cancer can help. It can be difficult talking about sex, but your doctor can help you get treatment and support. Being told you have cancer can be a big shock, even if you have prepared yourself for the possibility of your test being positive. Advance in science and technology means that many people are cured of cancer or live with for many years. Despite this, a cancer diagnosis can cause different fears and emotions for you and your loved ones. Living with prostate cancer can affect your everyday life, work, and relationship. If you are struggling to cope, try not to hide your emotions. Talk to your family and friends. If you think speaking to a professional might help, ask your doctor for the details of locum counseling. You will have hormone changes. Testosterone is mainly made by the testicles and controls the prostate works. Hormone therapy lowers the amount of testosterone in your body, which can affect overall mood, including your desire for sex. You may feel tearful of anger, or just not as usual yourself. These feelings are normal and can be caused by hormone therapy. For some men, returning to work helps them to get back to everyday life, but not everyone can continue working. You may decide to work part-time or take early retirement. There is no right or wrong answer. You may need to take a time of work, depending on treatment options offered for you. You may also need to take extra breaks at work, particularly if you are feeling exhausted. You may have it helpful to look at company policies and employee handbook to speak to your human resources department at your workplace for advice. I will be able to travel. If you drive, you need to be careful about your treatment is affecting you. Do not drive if you are tired or do not feel well. If you plan to travel abroad, having cancer can affect where you go and how long you will go away. Having cancer should not stop you from traveling. Still, it might affect travel insurance, car hire insurance that you need to take with you, and the activities you do while you're away. Thank you very much for attending this webinar.
Thank you, Doctor. Thank you so much for the wonderful presentation. Any questions? You can unmute and ask your questions. Or you can text in the chat group.
Well, there's a question, what is the stage where prostate cancer can be treatable? Actually, in the early stages, if you have a stage 1, that means that probably the cancer won't give you any problem in your life, especially if you are above 65 years old. Because actually we find a lot of tumors that we don't have to treat at all because the growth will be so slow that maybe it will grow after 30 years. So the probabilities of having a problem with this kind of cancer are really low. But we have to do the checkup to be sure that we can treat like a minimally invasive, or we can do a watchful waiting of this tumor before going to do any other further treatment, because the treatment can give you a lot of side effects. But at the early stages, when the tumor is small, we can treat it, or we can do a special follow-up of the cancer. Early stages, you don't have any symptom at all. That's why you have to come to the doctor to do the PSA, the prostatic antigen of the prostate, specific antigen, sorry. And if you are allowed, we can do also the digital examination of the prostate to know if you have any risk in the exploration. No, so you don't have, at the early stages, you don't have any symptom at all. You have to start to do the test starting at 50 years old. The success of recovery rate depends on different factors. In the early stages, we try to do minimal invasive surgeries for preserving the nerves, for preserving the erectile function, and also preserving the continence. So the rate is around 80–70%. But if your cancer is advanced, the success is less. But the expectancy of life is high in any case. Even though you are diagnosed with a cancer, you can live more than 5 to 10 years. So it's a tumor that grows slow. There are some exceptions that the tumor can grow so fast, but there are, especially in young guys with family history, and this is really weird. We don't see much cases like that. Most of the time, the tumor can grow slowly. We can do all the tests. We can prepare everything, all the treatment for you, and we can avoid any problem in the future. I think the question is the difference between BPH and prostate cancer. Okay, the BPH is a growing of the prostate, starting when you are 20 years old. By aging, because of the hormones, the prostate starts to grow, and the problem is that it's collapsing the channel of the urine, so the urine cannot pass properly. That can give you a lot of problems, especially in the bladder, because the bladder needs to push to empty for passing the urine. So the bladder of the bladder will get thick, and that can give you symptoms like frequency. You have to go frequently to the bathroom. You can have urgency. You have to wake up during the night several times. Sometimes you can have incontinence that you cannot control in the urine because of this damage of the bladder. And because of the closing of the passage, you have to push as well, so the flow will be weak. So there are symptoms that can happen with the BPH. BPH is a benign condition that we can treat to avoid problems, because that can give you problems as well. That can give you, if you cannot pass the urine, in one moment you can have a retention. So we have to put a catheter to empty the bladder. This is in the late stage if you don't receive any treatment. You can have also problems in the kidney because the urine is coming back to the kidney and can damage the kidney. You can have bleeding because the prostate is becoming so big that the veins surrounding the prostate can get so dilated that you can bleed. You can have stones, you can have infection because the urine is not coming out, so the remaining urine can get infected. So this is BPH, this is the benign condition. Apart from that, we have the prostate cancer. The prostate cancer is a normal growing of the cells that they don't die. So they start growing. And the problem is that these cells can go to other places in your body. They can go to your lungs, to your brain, to your bones. So this is what we call cancer. Yeah, when there's an abnormal growing of the cells that we cannot control. And at the early stages, as I said before, you don't have any symptoms. You can have BPH symptoms, and then sometimes the symptoms, when it's in a later stage and the patient didn't come to us, sometimes you can see patients with bone metastasis and other metastases, so you can do the diagnosis because of that. When you think that maybe this metastasis is coming from the bone. So they are the main difference. One is benign, one is cancer. You can have both. Yes, you can have both because the prostate can have a lot of disease at the same time. You can have prostatitis, like an infection. You can have also stones, small calcifications, but this is not something that you don't have to worry. You can have cysts, but this is also something that you don't have to worry about. The conditions that are making problems are the prostatic hyperplasia and the prostate cancer. Drinking water, no, for the prostate cancer, there's no relation between the development of this condition, but that can give you a lot of problems related to the prostatic hyperplasia, because if you don't drink water, the urine will get concentrate. So if the urine is concentrate, the crystals producing in the kidney can become stones, and you can have infections as well. So it's quite common during summer that we have a lot of patients with prostatitis because the outside is too hot, you don't drink enough, you sweat a lot, you lose a lot of liquid from your skin, so you get dehydrated. And we see a lot of cases of urinary tract infection because of dehydration. So it's important to drink water. Not all the guys will have a growing of the prostate. Not everybody will have problems. Most of the population will have it. But it's true that having a healthy lifestyle will decrease any risk. For example, this is something that is surprising, but eating ketchup is preventing the prostate cancer because the tomato contains some antioxidants that prevents the formation of some cancers. Also, the broccoli is good to eat. It's really good for preventing a prostatic disease. So it's well known that having a good lifestyle will decrease the risk of having prostate cancer. The growing, this is something that we still don't know. Maybe it's probably related with the genes, is heredity. So this is something that we don't know for sure, but for the cancer is totally know that if you consume more meat, if you don't drink enough, if you don't have, also doing sports can help you, because when you do a sport, you have some hormones that help your body to feel better and decrease the stress in your body. And also this stress decrease some hydrogens that can make oxidation of the tissue, and that will increase the risk of having cancer and damage of the DNA. So that's why it's good to have a healthy life, eat a lot of fruit and vegetables, do sports. That will help you, because also obesity is showing that because of the accumulation of the fat and all these products from the fat can increase the risk of cancer. Well, the preventive measure will be like that, no? Eating healthy, eat a lot of fruits and vegetables, do sports is important for everything in your life. That will help you also in your mental health. That will keep you awake, that will keep you more creative. and happy. That will help you also for depression. And it's important to eat healthy. We are what we eat. So we know now that a lot of bacteria that we have in our bowel depends on what we eat. And depending on the bacteria that we're eating, we can have a normal mental health. This is well known. So it's important to eat a lot of fruits and vegetables. Avoid all this prepared food, avoid fast food. I know it's hard, yeah, but well, we can take it once in a while. It's not mandatory every day, but at least try to decrease the amount of meat, decrease the amount of this Coca-Cola, Fanta, all these products are not good for your health, and eat a lot of fruits and vegetables. Okay, I hope I can cover all the questions. If anybody else have any other comment, please.
Yes, doctor, let's give 3 minutes more. Let's see if anybody has question.
Yeah, the take-home message will be that you have to go to, starting at 50 years old, even though you don't feel anything, it's better to go to your doctor and check the PSA. Do, if you can, the digital examination to know if you have any risk, especially if you have any relative. If it's your father and brother, you have more chances of having prostate cancer, especially if they were diagnosed below 65 years old. So this is something that we know. It's weird to find a family cancer, but we have some cases, so it's better to prevent, especially because you don't feel anything.
Generally, what is the minimum age this prostate cancer will start, madam?
Well, usually we can find it in people after 60, 70 years old, but we can find cases at 50. This is the common peak of the curve, no? But we can have cases at 40 as well. We don't do the recommendations of starting the screening of prostate cancer because the cases are really, really, really weird worldwide. So we don't have much cases starting at early ages. So that's why we recommend at 50 years old. But if you have family cancer, that will be the case, that you can have a early presentation of the prostate cancer. Yes, some of the cancers are related, like the breast cancer, because there are some genes, the BRCA1 and 2, that we share with prostate cancer. So now for women with breast cancer, they are doing some tests, genetic tests, to find out that if they have this mutation in the gene. But even though you have this mutation, doesn't mean that you will develop a cancer. So that's why, as urologists, we didn't start yet to do this screening of genetic tests, because the patient will get scared about something that shouldn't be scared. So there's a relation with breast cancer and BRCA genes, but the cases are, again, they are weird. We don't see, they are not common. So that's why we don't do these genetic tests. There are some tests, there are some experimental tests that they are trying to find a molecule or something that will guide us better, because the PSA is not specific, can rise with BPS, can rise if you ride a bicycle. So we don't have a 100% accurate test that will tell us this guy will develop prostate cancer. We are in the research of that. So maybe in the 5 to 10 years, we will find out, hopefully. Yes, well, the prostate cancer worldwide is one of the most common cancers in men. They're followed by, so depending of the country, could be first the colon cancer and then prostate cancer, but they are the two most common cancers in males. all over the world, especially men from Africa. They have a high incidence of prostate cancer. The lower incidence is in China, and in Europe and in America, depending of your origin, that will also change. So that means that maybe it's the lifestyle of the population, or maybe it's genetic. Yeah, but we can see that there are a lot of changes in the incidence of prostate cancer all over the world, depending of where you're living. Actually, here in the UAE, this is something that is uncommon because we have people coming from everywhere from the world. So here, it will be nice to do a study about the incidence and the prevalence, and which patient from which nationality are having more, if the lifestyle of UAE will affect, because we know that that will affect. So that will be a nice study. No, controlling your pee, what means that avoid going to pass the urine. This is something that we don't recommend. If you feel like you have to pass the urine, you have better to go, because that will affect your bladder. That will distension the bladder, and the bladder wall will suffer. So because also we recommend to drink a lot of water, so the frequency of going to pass the urine will increase as well. So this is something that the boss need to understand, that we are humans and we need to take care of ourselves. Nobody else will take care of us. So you have to drink water and you have to go to the bathroom to pass the urine. If you avoid going to pass the urine, that will damage your bladder especially. And you can increase, especially as women, we recommend for women to go every time that they want, because we have a lot of incidence of urinary tract infection, and this will increase the risk of infections if you don't pass the urine regularly. Thank you.
All right, doctor. Thank you. Thank you so much. Let's conclude. So, thank you so much, doctor. It's a wonderful presentation, and questions, nice questions also we received from our audience. So,
yeah. Really nice questions. Yeah.
Yes, yeah, very good questions, Rita. All
okay.
right.
Thank you so much.
Thank you everyone for joining.
Have a lovely day.
Yes, doctor. Everyone.
Thank you, Doc.
Thank you. Bye bye.
Thank you
so much. Bye.